Hi everyone, this is going to be another video on the clinical presentation of left and right-sided heart failure. I've already done one video when I talked about the classification of different types of heart failure, so I highly recommend watching that video if you don't know anything about heart failure at this stage. Because this video is assuming that you know all of that knowledge, and we're simply going to be talking about what the clinical presentation of a person who has heart failure is. So what clinical presentation essentially means is that we are looking at when they come into our practice, what are they going to look like, what are they going to tell us, and basically the features that they will have. What will they be complaining about? What will their presenting complaint be? So let's first talk about left-sided heart failure. And left-sided heart failure, if you can't remember, is when there is some pathology occurring with the left side of the heart such that it is unable to pump blood effectively, and that essentially means that there is a backing up of blood within the pulmonary circulation because blood isn't leaving the heart at the same rate at which it is entering the lungs. So usually the presenting complaint for left-sided heart failure and the symptoms of left-sided heart failure include shortness of breath, and medically shortness of breath is called dyspnea, and the British or the Australian spelling is like this. We also have the patient complaining of obviously they won't say it in this way, but we will identify it as being paroxysmal nocturnal dyspnea, and a very closely related condition called orthopnea. Now, paroxysmal nocturnal dyspnea can be abbreviated or shortened to PND, and essentially it means that when the patient goes to sleep at night, they may wake up 2 or 3 times a night complaining of shortness of breath, extreme shortness of breath, such that they're essentially gasping and they are unable to breathe for themselves. And they will say that, you know, they wake up in the middle of the night, they can't breathe. When they sit up, they feel better, and then they go back to sleep and they are fine for the rest of the night. So that's what paroxysmal nocturnal dyspnea is. Orthopnea, on the other hand, is when the patient, regardless of if they're sleeping or not, when they simply lie down, they experience shortness of breath. So the patient will say that even when they're laying in bed, maybe at night, I know a lot of people, including me, spend at least half an hour in bed at night just on their phone checking Facebook or something like that. They may say that, you know, at night when I'm on my phone in bed, I can't breathe properly, and that is a sign more so of orthopnea. And they may say that when they sit up for a while, their symptoms are relieved, but then as soon as they lay back down, they pretty much experience the symptoms once again. So another condition that they may also complain about, and this isn't necessarily associated with just left-sided heart failure, but can be associated with right-sided heart failure as well, is pulmonary edema, and that's if both of the heart failures can be occurring at the same time as well, as seen in congestive heart failure. Now, pulmonary edema, as its name suggests, is when there is fluid buildup in the lungs, and that is what actually causes for the paroxysmal nocturnal dyspnea and orthopnea, because essentially the fluid within the lungs blocks the alveoli or the air sacs and prevents effective gas exchange occurring between the blood vessels and the external environment, or the environment that is present within the lungs. So in addition to all of this, because left-sided heart failure presents with pulmonary symptoms, the patient may also complain that maybe in the morning, and that's when usually people cough to get rid of what's built up during the night, they may complain of a pink and frothy sputum. So sputum just refers to the actual substance that comes out of a person's mouth or nose when they cough. And a patient with left-sided heart failure will have their sputum be colored pink and that pinkness comes from blood. That's because the pulmonary edema or fibrosis is causing damage to the tissues of the lungs and causing them to bleed. So they won't directly see blood in their sputum, but because blood is present within the lungs, it will sort of be pink tinged sputum. I sort of miswrote this here, but it would be frothy as well, because the edematous fluid itself will also come up in addition to the cough, maybe just normal green colored cough that is coming out. So that frothiness comes from the mixing or the constant movement of that edematous fluid in the lungs. The person, because of this fluid buildup, may also complain of a chronic cough. So something, they feel like something's in their lungs or in their airways, and they will say that, oh, I just can't clear this thing out. That's usually because of pulmonary edema. Also fatigue may result, and that's pretty self-explanatory, because if we aren't having adequate oxygen exchange occurring within the lungs, then that would mean that we aren't able to oxygenate blood to whatever its 96-98% that it normally is. And because there's hypoperfusion of tissues occurring because of this loss of oxygen, we are essentially allowing for fatigue to ensue. Finally, the patient may also complain of wheezing, and wheezing in this particular scenario has a special name, in that wheezing is also called, in the frame of heart failure, it's also called cardiac asthma. And asthma, conventionally or classically, is a condition where we have inadequate breathing of the patient, and that's due to pulmonary conditions only. When the bronchioles of the lungs become constricted, usually because of some allergen, and when this constriction occurs, there is inadequate flow of air. But this is cardiac asthma that we're talking about, and cardiac asthma is when there is wheezing, coughing, and shortness of breath present, like in normal asthma or classic asthma. But this is not due to a sole pulmonary condition, rather it is due to the congestive heart failure that is occurring, and that's the fluid buildup that is occurring within the lungs. So it's important to delineate the difference between classical asthma and cardiac asthma, because if we label a patient as simply having classical asthma, the mechanism or the course of treatment is a lot different to what we see for cardiac asthma. And that's for obvious reasons, since they are affecting, or the source of their symptoms are from two completely different organs. So now that we've explored left-sided heart failure, let's look at the presenting symptoms and complaints that can be seen with right-sided heart failure. Now, if you remember back to my video when I talked about both of these sides of the heart, right-sided heart failure, unlike left-sided heart failure, originates from complications occurring in the pulmonary circulation, and it affects the systemic circulation. So the symptoms that we'll see will be related to the systemic circulation. The primary symptom, and also probably one of the most dangerous symptoms that we see, is what's called a congested liver. And liver congestion essentially means that clearing of deoxygenated blood from the liver is not occurring properly. And that is occurring because the liver is pretty much directly connected to the right atrium of the heart and the right side of the heart, since it pretty much directly empties into the inferior vena cava. So if there is inadequate clearing of, or if there is inadequate activity of the right side of the heart, there will be inadequate clearing of blood from the liver, which means that deoxygenated blood builds up within the liver, and if it builds up enough, we get what's called a nutmeg liver. And if you've ever split open a nutmeg, you'll see that it appears sort of, I'll try to draw a nutmeg here. Say if this is the inside of it, it sort of has spots within it, and that's what the liver appears like. Because there has been a buildup of blood to such an extent within the liver, it essentially leaks out of the liver tissues and causes for sort of a petechial rash type morphology on the surface of the liver. Obviously, it's not a particular rash, but it looks like that. And that's what gives its nutmeg appearance. There is so much blood building up in the liver that not only will the liver increase in size, but it will also allow for blood to leak out and form the sort of speckled appearance. Other symptoms also include a loss of appetite, and that makes sense because if a person has quite advanced right-sided heart failure, then they will experience what's called ascites, when there is buildup of fluid or swelling or edema within the abdominal cavity or the peritoneal cavity. And if this abdominal fluid presses upon abdominal organs such as the stomach and small intestine, it will decrease their lumen size, which means that the patient will not have as much of an appetite because their size of the organs and the ability of those organs to hold food is compromised. They will also likely experience abdominal pain, and this is once again a result of ascites. If the abdominal fluid is pressing on a nerve within the abdomen, then that will cause pain. Edema will occur in the feet and legs, and this is, I'll actually write it instead as peripheral edema. And peripheral edema occurs once again quite obviously because right-sided heart failure is a condition that affects the systemic circulation. Nocturia may also occur, and the reason why this occurs is quite interesting. Nocturia is when the patient has to get up in the middle of the night at least once to urinate, essentially. The normal range for urinating at night is between 0 to 1 times a night. So pretty much not urinating at night is normal, but urinating at night is pretty much abnormal. So the reason why a patient experiences nocturia with right-sided heart failure is that during the day they are standing up, so gravity will allow for the edematous fluid to flow from pretty much the central area of the body, which is higher up, to being lower, and that's why we get fluid buildup in the legs and swelling in the legs. But at night, obviously, you're sleeping horizontally, so all of that fluid is going to be redistributed from the peripheries of the body where it's built up during the day and will move back into the bloodstream. So essentially, blood volume will increase to such an extent that the kidneys will recognize that there is an increase in blood volume and they will create more urine. And that creation of more urine will mean that more urine is stored in the bladder, and the person will be forced to wake up in the middle of the night to void their bladder because there has been so much fluid returned back to the blood that there is too much and it has to be cleared. So that's why nocturia can also be a symptom of right-sided heart failure. And in addition to both ascites occurring and other types of edema, fluid buildup can, since fluid is water and water is heavier than fat, a person with right-sided heart failure will have a very large weight gain, and this weight gain will be very fast as well. Because fluid is constantly being pushed out of the capillaries of tissues, and if this tissue buildup is adequate enough, then we will see a marked increase in weight. And finally, like left-sided heart failure and congestive heart failure, the person may complain of tiredness and fatigue. And this is because since the right side of the heart is unable to pump blood effectively into the lungs, there is a buildup of deoxygenated blood, and the body can't really do anything with deoxygenated blood, which means that the person will feel tired and they will essentially not be able to provide their organs with enough oxygen. So in review, the presenting complaints and symptoms of left-sided and right-sided heart failure include, for left-sided heart failure, shortness of breath, PND and orthopnea, pulmonary edema, having a pink and frothy sputum, a chronic cough, fatigue, cardiac asthma. And right-sided heart failure includes congested liver or a nutmeg liver on a gross anatomical perspective, loss of appetite, abdominal pain, peripheral edema, nocturia, ascites, weight gain, tiredness, and fatigue. Now, this diagram basically just shows you a diagrammatical representation of the symptoms that I've been talking about so far, and that's why I thought it might be a little bit effective to include it in this video, because it shows you what a patient looks like with a both left-sided and right-sided heart failure. So firstly, let's quickly run through, and I'll only quickly do this because we've already gone through them on the previous slide. But essentially with left-sided heart failure, as we saw before, we get PND. So starting from here, we get paroxysmal nocturnal dyspnea. And one thing that I didn't talk about was an elevated papillary wedge pressure. And what that means is that a wedge pressure is when we insert a catheter, usually through the femoral artery or vein, usually femoral artery, and that catheter moves all the way into the heart and into the pulmonary capillaries, and it has a wedge on the side, and we inflate and deflate the wedge to try and find the blood pressure that is within the pulmonary circulation of the patient. And that blood pressure allows us to see if there is any fluid buildup, because if there is fluid buildup, then it's likely that there is a greater force of blood trying to push through the lungs to counteract the effects of that fluid. The patient may also be restless, which is something that I didn't talk about. Confusion may also occur because the patient's organs, especially the brain, are not receiving enough oxygen, so they may exhibit some neurological symptoms. Orthopnea may occur, tachycardia as well, because there's such a buildup of fluid within the lungs, the heart is trying to get rid of that fluid. So it will try and compensate by increasing heart rate and getting rid of that fluid. But obviously, since in especially advanced left-sided heart failure, since the left side of the heart may be dilated as well, this tachycardia is pretty much to no avail because the heart isn't able to contract properly. The person may also experience exertional dyspnea, which is when they will experience shortness of breath on exertion. And this is not just shortness of breath. Usually people do experience some shortness of breath with exercise, but this is pretty much with any exertion, not strenuous exercise to any extent. It can just be maybe walking for a short while, standing up in some cases. So as you can see, it's quite dangerous and can result in syncope as well. Fatigue and cyanosis. Cyanosis occurs because there is inadequate oxygenation of blood, which means that both central, which is seen on this person's lips, and peripheral cyanosis can occur. The symptoms of pulmonary congestion include a cough, which I talked about, wheezing, blood-tinged sputum, tachypnea, which is an increased breathing rate, and that occurs because there is a fluid buildup within the lungs, so the lungs are trying to compensate to allow for oxygenation by not allowing for an increase in lung volume, so an increase in oxygen, because obviously the fluid is impeding on that, but by increasing the breathing rate, such that these same vessels, or the vessels that have been unaffected by the pulmonary edema, are able to allow for an exchange of gases at a greater rate. And auscultation with a stethoscope will allow you to see crackles as well on both inspiration and expiration, usually on inspiration because that's when the air will fill the lungs and they will expand and the edematous fluid will move around. And the crackles occur because the air sort of moves through that fluid. So the symptoms of left-sided heart failure, PND, capillary wedge pressure, all of those, orthopnea, tachycardia. In addition, the exertional dyspnea can be associated with muscle wasting as well. All of these symptoms are also present in another condition called aortic stenosis. And aortic stenosis is when there is a shortening of the aortic valve such that it doesn't open properly. And since it doesn't open properly, inadequate blood flow isn't able to occur out of that valve, and that subsequently means that we have tiredness, exertion, all of these symptoms occurring. So that's just a side note. With right-sided heart failure, we have fatigue, an increased peripheral venous pressure, And that's because, as I mentioned before, there is a buildup of blood in various organs such as the liver, and since the liver has built up blood within itself, there is an increase or buildup of fluid within the actual inferior and superior vena cava as well, because the right side of the heart is unable to pump blood effectively, which means that blood will build up. Ascites, an enlarged liver and spleen can also occur. Liver is pretty self-explanatory because I've already talked about it, but an enlarged spleen can also occur because the spleen actually contains a lot of blood within it, and it actually contains, just as a fun fact, 1/3 of the body's platelets. So since the spleen anyway has a lot of blood, if there is inadequate flow of blood in the first place, then there is going to be inadequate clearing of blood from the spleen, which means that it increases in size, and it increases anteriorly and inferiorly. There is also something called dependent edema occurring. Edema I did talk about before, but dependent edema is when the edema flows based on gravity. So it's dependent on gravitational pull, essentially. Weight gain can also occur, which I talked about. Lack of appetite due to compression on organs. Interestingly as well, anorexia can also occur, and this the reason why I say it's interesting is because both weight gain and anorexia can occur at the same time, and that's when the definition of anorexia is quite important. Anorexia is not simply a reduction in body weight. It's when the person has ideas that they are much larger or much larger in body mass than what they truly are. And that's essentially what's happening in this case. The patient will have a decreased appetite, which will cause them to decrease their fat stores, and that will cause for anorexia to occur. But at the same time, since fluid buildup is also occurring, this fluid buildup will cause for a weight gain. So that's not something that they can control, but even though they're eating less, they are still gaining weight. And that can be quite a serious and quite a dark spiral for the patient, because no matter how hard they try to control their weight through the stimulation of various thought processes due to anorexia, but they will always result in weight gain. So anorexia, complications of gastrointestinal distress because of a lack of food intake. A distended jugular vein will also be present because the jugular vein, if you know anything about physical examination of the cardiovascular system, you'll know that the jugular vein will directly empties into the right atrium, and that's why we do a jugular venous pressure test. So since this particular vein directly empties into the heart, it's a good indicator if right-sided heart failure is present, because if it is present, then blood will be backing up, within this vein as well. And there also may be secondary chronic pulmonary problems, and that's when right-sided heart failure is present with left-sided heart failure, and both conditions are happening at the same time. That's called biventricular heart failure or congestive heart failure. Alright, so what I want to end this video with is talking about, as a clinician, not only do you want to be aware of the physical signs that are present with these conditions, but you also want to be aware of what happens to the vital signs. So the vital signs are something that we've tested for every patient. I haven't talked about them in another video in great detail, so I want to mention them briefly in this video. I want to also share with you the mnemonic that I use to remember the vital signs, because sometimes in OSCEs or tests, people may trick you and not include some vital signs, and you have to be eagle-eyed and point them out on that, because usually they will take away marks based on if your observation skills are not up to par. So the way in which I remember all of the vital signs is with the mnemonic SPORT. And it is quite effective. Unfortunately, blood pressure does not really come into this to a great extent, because it starts with B, and I couldn't find a very good mnemonic for that. That's why I've substituted S for blood pressure. So blood pressure is written as systolic blood pressure, but obviously when you're taking a blood pressure of a patient, you're going to take their systolic and diastolic blood pressure, but that's how I remember it. So systolic blood pressure, pulse, oximetry, respiratory rate, or I'll just write respiration, and temperature. So these are your 5 vital signs, and this is how I remember it, using the mnemonic or the acronym, I should say, of SPORT. So firstly, looking at systolic blood pressure or blood pressure, with either congestive heart failure or left or right-sided heart failure, we will see what's called a narrowed pulse pressure. So a narrowed pulse pressure. And if you remember my video when I talked about mean arterial pressure, pulse pressure is defined by, so I'll write pulse pressure as double P, is defined by the systolic blood pressure minus the diastolic blood pressure. So if we have a narrow pulse pressure, then obviously the values of the systolic blood pressure will be quite similar to the diastolic blood pressure. And the cause of a narrowed pulse pressure is usually due to a reduced stroke volume. So if we quickly think about what the effects of a reduced stroke volume would be, we are pumping less blood out of the heart with each beat, which means that maybe the heart is working harder and has to push against a larger force or larger pressure in the first place. So that would mean that the diastolic blood pressure will be increased, right? And since we're pushing out less blood in the first place, then the systolic blood pressure will be decreased because we aren't pushing as much blood, and without enough volume, our pressure will be decreased as well. So due to a reduction in systolic blood pressure and an increase in diastolic blood pressure, we get a narrowed pulse pressure. On the other hand, when we talk about pulse, the effects of heart failure include tachycardia, which was something that I talked about before. And tachycardia is due to a reduced blood flow, and essentially the heart tries to compensate by increasing heart rate. We also may experience arrhythmias, and that's usually because of the stasis of blood. The most common arrhythmia that we see with heart failure is atrial fibrillation, and that's because either dilation of the right ventricle or left ventricle will cause for the backup of blood or the stasis of blood within the atria, and the stasis of blood causes for electrical abnormalities, which essentially means that we are going to get some sort of arrhythmia. And this arrhythmia is defined as being irregular. So what does that mean? The heartbeat itself will be irregular, which is what makes sense with any arrhythmia, but this irregular heartbeat will be occurring at irregular intervals. So unlike, say for example, if we take a regularly irregular heart rate, there will be irregular heartbeats occurring, but they will be occurring at regular intervals. In this case, irregularly irregular means one group of heartbeats may be occurring here, then nothing will happen, and then another one here. So that's irregularly irregular, regularly irregular. I know it's a little difficult, everything sounds the same, but that's how it is. Oximetry, on the other hand, will be decreased in terms of oxygen saturation for both left and right-sided heart failure, because firstly, in left-sided heart failure, we aren't allowing for adequate oxygenation of the blood in the first place, and in right-sided heart failure, due to inadequate clearing of deoxygenated blood from peripheral tissues, we are going to get a lower oxygen reading. Respiration or respiratory rate will be higher, so tachypnea will be occurring, and that is because there will be a lack of perfusion in left-sided heart failure if pulmonary edema is present. And as I mentioned before, the lungs will try to, like the heart does with tachycardia, compensate for a lack of adequate gas exchange and increase the rate of breathing. Now, temperature, on the other hand, is something that doesn't really change. We may see some temperature change, say for example, if there is excessive edema, and maybe if there is the movement of some cells that are usually not found in a particular tissue, and therefore we might have an immune response which causes a fever. But we really don't see any temperature changes with cardiac conditions. I'm just trying to think, maybe if cardiac function is very, very severely affected, then we may see a lack of proper perfusion of blood to the extremities, which will cause for a decrease in temperature in those extremities because enough warm oxygenated blood is not reaching them, and the blood is essentially just in a state of stasis in those tissues. But that's really the only example that I can think about. You won't really see any sort of negative effects on pressure or any changes in pressure due to cardiac dysfunction or cardiac failure. So in this video, we've talked about left and right-sided heart failure, their presentations, and the changes that we see on vital signs, as well as I provided you with a mnemonic to remember them on vital signs for heart failure. So I hope it has all made sense today. I hope you've enjoyed it, and thank you very much for watching.